Hello, everyone.
We're going to go over chemotherapy treatments for osteosarcoma.
But first, what is osteosarcoma?
Good question. Osteosarcoma is the most common cancer of the bone. Amazingly, normal bone is dynamic. It is constantly degrading and building itself back up. Cells called osteoclasts will degrade bone for the body to use in other areas, while cells called osteoblasts will come back and repair or fill in that bone.
That's right. And when those osteoblasts mutate, things can go awry.
And those cells may get out of hand and start multiplying uncontrollably. This is how you get a bone tumor.
And since these bone tumors are made out of mutated bone cells, they're hard, but not as strong as normal bone. Pathological fractures are one way people find out they have osteosarcoma.
Ouch! Yeah, and some other signs you have are bone pain, limping, or limited range of motion depending on the tumor site, and/or tenderness, swelling, or redness at that tumor site.
Not fun. Even less fun is who's affected. About 1 in 200,000 people get osteosarcoma. However, most of them are between ages 10 and 20. The decades surrounding that age bracket are at the next highest risk, and then your risk decreases as you get older.
I guess that makes sense because that's when you're going through your growth spurt and needing to make lots of healthy osteoblasts already. Like most types of cancer, radiation, chemotherapy, and surgery are the most common medical treatments, with studies showing that a combination of chemotherapy and surgery gives the best outcome.
Nutrition and hydration are also super important in staying as healthy as you can during treatment time.
So I think we have a pretty good grasp on what radiation and surgery mean, but what really is chemotherapy?
Chemotherapy uses pharmaceuticals to kill the cancer cells. Unfortunately, these drugs aren't always smart enough to tell the difference between normal cells and cancer cells, so they end up killing them all.
And that's why you get so sick. However, since cancer cells are multiplying, dividing, and creating more of themselves at a faster rate than normal functioning cells, these drugs tend to target essential components of the cell division process,
with the hopes that those rapidly dividing cancer cells are the first to go.
So here we look at 9 most common chemo drugs given to people with osteosarcoma.
Methotrexate, or high-dose methotrexate, is a dinosaur drug developed all the way back in the 1970s, but still effective today. It's so strong that it's often paired with a drug called leucovorin to kind of rescue or relieve the healthy cells that are being bombarded. You can take it intravenously through an IV, get it as a shot in your muscle or spinal fluid, or swallow a pill. It will all depend on your doctor and where your malignant tumor is located.
Gemcitabine is another drug in the same category as methotrexate. You can only get it through an IV though. These drugs are called antimetabolites and are very similar in structure to normal molecules that cells use to function and divide. For example, methotrexate acts like folinic acid.
Next, we have etoposide, a topoisomerase II inhibitor. This bad boy comes in a variety of forms for your doctor to choose from. And as a topoisomerase inhibitor, it prevents topoisomerase from doing its job.
So little Tops here is hanging out with etoposide. Instead of DNA, the DNA gets all mad and twisted and tangles itself up until it can no longer replicate.
Next up are our anthracycline anti-tumor antibiotics, doxorubicin and epirubicin. They are also both similar to each other in structure and are only administered through an IV. They are also so potent that there is a maximum lifetime dosage you're allowed to have. And if they leak out of your vein or IV, they'll cause tissue damage and blistering. Anthracycline or anti-tumor antibiotics are derived from Streptomyces bacterium.
In addition to topoisomerase inhibitor activity like etoposide, it makes its way in between the base pairs of the DNA-RNA strand, further preventing or halting transcription.
Now we have our alkylating agents, ifosfamide and cyclophosphamide. These guys add alkyl groups to DNA, which screws up the nice base pairing system DNA has going on and results in cross-linked, intrastranded, and interstranded DNA flubs. These crazy pairings unwind, open, and can fragment DNA, halting transcription so the cells can't divide and eventually die.
And now our alkaline-like agent, cisplatin and carboplatin, work in a similar manner, but instead of adding an alkyl group, they use a platinum base to invade cancer cells and link up with a seventh nitrogen of guanine to form those interstrand crosslinks. All of these drugs share some common side effects. They are
Vomiting,
nausea,
hair loss,
low blood counts,
mouth sores,
weakness and fatigue, and increased susceptibility to infection.
as well as a list of some less common side effects. So until the 1960s, emergency amputation was essentially your only option. So today, you have a whole lot more to look forward to.
You only know how strong you are until being strong is the only choice you have.